So we now move on to, this is the last for this session. We've got our very own Tayyeba Kiran, and I'm very excited and I feel really privileged to introduce Tayyeba because I work with her on a daily basis, and she's a bright, budding researcher. She's a clinical psychologist and a global mental health coordinator. She's the assistant director for research at our organization. And Tayyeba was the trial manager for the CMAP study, which is probably one of the largest therapist-delivered intervention trial anywhere. And she managed it extremely well. She's also a co-investigator in a number of other projects. She's a master trainer for our CMAP and YCMAP and learning through play interventions. So over to you, Tayyeba.
Thank you so much, Professor Naseem, for the introduction. I know a lot has already been covered in terms of suicide prevention in Pakistan by Professor Imran, Professor Caroline, and Maria. I will try my best not repeat what has already been covered. So next slide, please. So as Maria said, adolescent suicide is a significant public health problem globally, and rate of attempted suicides are highest for people aged between 15 to 29 years. It is the second leading cause of death for adolescents between 15 and 19 years, and it is one of the 3 leading causes of death worldwide among the youth younger than 25 years. The prevention of self-harm and suicidal behavior is therefore a primary social and medical concern throughout the world. Next slide, please, Sameem. So Caroline has already talked about the qualitative studies and evidence from the qualitative study. I just want to summarize the qualitative evidence for suicide among adolescents from other parts of the world, because to design and develop culturally relevant approaches or solutions for suicide prevention, a thorough understanding of factors that adolescents think can possibly contribute to suicide behaviors is hugely important. So if we look at the slide, most of the adolescents talked about the negative emotions toward themselves, a devalued sense of self, and a dominant feeling that they were not being accepted by the family and the wider community. And they also talk about the events that happened just before their act of self-harm and that they consider were not within their control. They struggled to move beyond those lived situations or lived events. So as Professor Imran talked about the precipitating factor, and he mentioned that even in adults, the interpersonal conflicts are one of the major contributors towards self-harm and suicide behaviors. It is the situation is the same for adolescents as well. They talk about rigid and overwhelming family dynamics and their perception that it was impossible to escape from these unbearable situations like the disturbed family relationships and interpersonal conflicts. They also talked about the feelings of revenge, that they want to make other people feel guilty for their death or suicide. As other people or presenters has already mentioned, that stigma is the major barrier in accessing help for suicide prevention. Next slide, please. So if we talk about evidence from Pakistan, next slide. Pakistan is the young nation with more than 50% of the population is under the age of 25 years. Next slide, please. Here are some evidences from the newspaper clippings where we can see that the domestic disputes are the major factors contributing toward stress in adolescents and ultimately to the self-harm and suicide. What we have noticed that the self-harm and suicide cases are increased at the time when the matriculation results are announced, or at the time of admission to the medical colleges in Pakistan. Next slide, please. So here are some other clippings like harassment, relationship difficulties, and social media influences also contributed towards self-harm and suicide in this target population. Next slide, please. So I will now briefly talk about our qualitative study. This is aimed to explore lived experiences of adolescents with the recent history of self-harm. This qualitative study, along with our CMAP work, actually informed this YCMAP study, that is self-harm and suicide prevention trial in adolescents. This is actually an AMPHIL project by a Pill researcher. Next slide, please. So this qualitative study actually aimed at exploring the needs of the adolescent who attempted self-harm, their thoughts about the possible consequences of their self-harm behavior, and the kind of help that they think is important for self-harm and suicide prevention in this target population. We recruited young people from emergency department from a public hospital in Rawalpindi. Next slide, please. So for this qualitative study, we recruited a total of 16 adolescents. 9 were female, 7 were male. They were between the age of 12 to 18 years. And we recruited those who were able to engage and participate and respond to the questions in our qualitative interviews. Next slide, please. So we developed a quite comprehensive topic guide, and we followed a thorough process. We involved expert panel to generate question, and this topic guide was a live document, and we kept on changing as we move along in the analysis process for these qualitative interviews. Next slide, please. We used a framework approach to analyze these qualitative results. Next slide, please. So to add rigor in the analysis process and to improve the credibility and trustworthiness of the findings, the qualitative research team that was involved in the project was continually supervised by experts both in the UK and Pakistan. We did the translation of all the transcript into English and then back translated. We did respondent validation as well, just to confirm whether the interpretation done by the qualitative researcher is similar to what the participants perceived about their self-harm behavior. Next slide, please. So here are the demographic characteristics. The age range of the adolescent range between 14 to 17 years. All except one used rat pills as method of suicide, self-harm. Next slide, please. So here are some findings from the qualitative work that we did. So as I mentioned earlier, that interpersonal conflicts were considered as a major predisposing factor by the adolescent for their self-harm behaviors. Like one adolescent talked about the fights and arguments between their parents all the time at their home. Then they talked about emotional crisis like feeling of anger and sadness. And if we talk about the problem-solving abilities, most of the adolescents mentioned that they find self-harm as the only option to come out of the problems that they were facing in their lives. Next slide, please. So since most of the adolescents mentioned that their self-harm behavior was impulsive, and they mentioned when they reflected on their behavior, they experienced a feeling of regret, and they mentioned that they realized that self-harm is not the answer to the problems that they are facing in their life. Next slide, please. So they also talked about psychosocial impact of their self-harm behavior, like they experienced disturbance in their environment, and they feel even more stressed out after this episode of self-harm. And when they talked about the suggestions for the self-harm prevention strategies, they said that the adolescents shall be provided with the opportunity to learn how to make good decisions in their life. They talked about an opportunity where they can talk about their feelings and whatever is going on in their environment. Some other also talked about there should be the stories of those who wanted to commit suicide, but then they find a better solution than self-harm, and stories with a good message. They talked about the need to show them the videos, why people commit suicide, and discuss about these stories. They emphasized the importance of involving both family and friends who will help, because they think that they actually listen to the family and friends. Next slide, please. So the qualitative work is very important, because it helps a lot in understanding the cultural and contextual basis that makes the explanatory model of self-harm and suicide in adolescents. And this work actually led to the refinement of our YC-MAP manual. Next slide, please. So this is the multi-center RCT to evaluate clinical and cost effectiveness of YC-MAP intervention. Next slide, please. YC-MAP is actually an integrated manual that is based on another intervention called cutting down and our existing CMAP intervention. And we integrated these two manuals and then adapted these for the Pakistani population. So the primary aim of the study is to assess the clinical effectiveness and in terms of reduction, repetition of self-harm over the period of 12 months. And secondary outcomes include reduction in suicidal ideation, hopelessness, distress, and improvement in quality of life. We also want to assess cost effectiveness over 1 year of this proposed intervention, and how generalizable the findings are across all other regions in Pakistan. Next slide, please. So here are some objectives for the qualitative interviews. We are in the process of conducting in-depth qualitative interviews with the participants. We did a focus group with teachers of young students as well. I will briefly mention the highlights from the focus group that we conducted. Next slide, please. Can you please skip this and move to the next slide, please? So we have successfully completed internal pilot for this project, and we have recruited more than 200 participants from general practices, emergency department, medical juniors, and we included self-referral as well. We are recruiting from 5 big cities across Pakistan. Next slide, please. Can we please move to the next slide after this inclusion and exclusion criteria? So I will very briefly talk about the intervention. The intervention is comprised of 8 to 10 sessions that are being delivered over the period of 3 months. So the intervention actually involve culturally adapted stories of 4 young people with the different mix of age group. It has the manual has very interesting homework assignments that we further adapted in terms of the cultural implication that we have here in Pakistan, and considering the stigma attached to self-harm as well. Next, please. Next slide, please. So, as I mentioned, we already conducted a focus group with the teachers, and this was a focus group with 12 teachers. They come up with they come up with their views about factors that can contribute to the self-harm. They talked about the academic pressure and competition between students. They talked about the financial hardship, lack of confidence, and they particularly emphasized on how at times teachers' attitude can contribute towards stress and self-harm behavior in students, like teacher being very judgmental, using harsh comments can make the students even more stressed out. Next slide, please. Samin, can we please move to the next slide? So they also come up with some very good suggestions for prevention of self-harm in this population, like suggestion for visits by trained mental health professionals, some extra class where the students could have opportunity to talk about their stressors, teachers training on how to deal with the students, and particularly on how to provide psychological first aid to the vulnerable students, and working on teachers' attitude. And then they emphasized the role of peer support. They particularly talked about the triangle, like how parents, teachers, and students can work together to prevent stress and self-harm behavior in this population. Next slide, please. So the trial is currently recruiting. We are in the process of recruiting and assessments and delivering intervention. At the end, I just want to thank all the participants of YCMAP trial, our funder, and all the other collaborators across Pakistan. Thank you. Thank you so much.
Thank you, Tayyeba, for sharing this important work, particularly in a country like Pakistan, where this is such a vulnerable group, but there's hardly any support available or provided to them. So all this work is extremely important, and I'm so proud of all of you that are contributing